Hi! Welcome to Doc Martin's YouTube channel. Our last two episodes, we talked about the global burden of disease of spinal disorders such as low back and neck pain, strategies for mitigating them while seated from your workstation. This week, we will discuss a common occupational hazard brought about by prolonged activities in front of a keyboard or gaming console called carpal tunnel syndrome. This is brought about by repetitive movements of the wrists and fingers, causing cumulative strain to the bones, muscles, ligaments, and nerves that can give you numbness and tingling in the arms. It is and can be a very common cause of work disability experienced by our workforce and our young adults addicted to e-gaming activities several hours a day. This video is about natural solutions you can do to treat and possibly even prevent carpal tunnel syndrome. So, let's get cracking! The carpal tunnel is a tunnel which is formed by the little bones, muscles, and connective tissue of the wrist. Tendons, veins, arteries, and nerves pass on its way to the fingers through the tunnel. It is known to be the most common pinched nerve syndrome of the arm, and some studies estimate as much as 20% of all those complaining of arm pain will be diagnosed with carpal tunnel syndrome. It is basically a pinching of the median nerve as it dives into the carpal tunnel, giving you pain, burning, weakness, numbness, or tingling in the area supplied by the median nerve, basically your thumb, second finger, and middle finger. At first, symptoms may occur only at night and is relieved by simply shaking out the hand or wrist. However, as the condition progresses, patients may experience pain throughout the day, clumsiness, loss of grip, and loss of function in some muscles of the hand. Who is most at risk? In most cases, carpal tunnel syndrome is diagnosed in patients between the ages of 50 and 75. Women are more susceptible than men. Other risk factors include pregnancies and jobs that involve the use of repetitive hand or wrist motions, such as hairdressers or assembly line workers. However, nowadays we're seeing this much frequently in the younger population due to the advent of e-games. Basically, anyone that has excessive fluid accumulation, ligament laxity, or repetitive flexion, extension movements of the wrist and the hand are at risk for developing this condition. Now, let me share with you my favorite techniques to treat and possibly prevent carpal tunnel syndrome. Movement is magic. It has a way of pumping fluid out of stress areas of our wrist and body. Move frequently and often. So for this, look no further than the wax on, wax off exercise shown in the movie Karate Kid. Wax on, wax off, wax on, wax off, wax on. Okay. You can also roll your shoulders back and forth like we did in the last video. Now, another way of releasing pressure off the carpal tunnel is by doing a technique called wrist traction. So, you grab your wrist like so, and you're going to put opposing pressure, about 15-20 pounds of pressure, pulling this way and that way. And you just hold it for 15 to 20 seconds, repeat 3 to 4 times. Do the same on the other side. Here, you grab here, 15 to 20 pounds of pressure. This hand is pulling that way, this hand is pulling that way. And hold that for 15 to 20 seconds. Repeat 3 to 4 times. So, fascial restrictions have been documented to show or to cause nerve pressure. So think of a sheet of silk clothing on top of your skin that is designed to glide smoothly on top of your body. Any adhesion or tightness at all can prevent the normal sliding and gliding, causing more pressure on the nerves of the carpal tunnel. The idea here is to put sustained pressure and rub in different directions, as the combination of friction, heat, and movement has been shown to release the fascial restriction. Let me demonstrate that for you. So, find the center of your palm here and make a sharp edge with your other hand, and you put 1 to 2 pounds of pressure and you rub it in different directions while the pressure is sustained. You can go left to right, up to down. You can follow it at an angle and make like a star. If you feel some restrictions, you just gently work it out in that position until you feel the restrictions melt away under your fingers. So this is one of the key points to releasing the carpal tunnel. The other point is on the back of the hand. You make a line that corrects this and this finger, and where they intersect is another fascial point. Same, you make a sharp edge with your knuckle. Put your hand here and just put about 1 to 2 pounds of pressure and gently move the fascia up and down, left and right at an angle, almost like a star. Okay? Now, after you feel it glide smoothly, then you go to the next point. The next point is you follow these 2 fingers down, and where it depresses here is another fascial point. Again, you can use your fingertips in here, 1 to 2 pounds of pressure, rub it up and down, left to right at an angle until you feel the fascia glide smoothly on top of, under the pressure of your finger. After the fascial restriction, I like to incorporate a technique called nerve flossing. The nerve runs from here to here, and the idea is to stretch it on one end while you're releasing it on the other end. So I will stretch it here while releasing it here by curling my wrist, and then I will stretch it on the wrist while I am releasing it here by the neck. And I do this 10 to 15 times, just like this. So if you can imagine, I'm flossing the nerve from one end to the other, gently releasing restrictions from here all the way down here. Last but not least, supplementation with vitamin B6. Some studies have shown that 50 to 100 milligrams of vitamin B6 may ease symptoms due to improved elasticity of the synovium and by acting as a mild diuretic. Do not take more than 100 milligrams unless supervised by a doctor, and do not take it for too long a period of time. Too much B6 can also be problematic. If your symptoms persist and worsen over time, please seek professional help from your healthcare provider, especially if you notice the muscles of your hands getting smaller or changing shape, a condition called atrophy. Professional help and healing is sometimes required to treat persistent cases. Remember, this is Doc Martin saying, every day, in every way, you are getting better and better.